Jayne, welcome. Welcome.
Welcome,
Thank
Jay.
you so much. Hi. Good to see
So,
you both.
Jayne, let me introduce Anup Singh. So, Anup Singh is the founder of D Life, one of the largest and oldest Indian community of community which propagates low carb and change the life of thousands of people. Very big community with lot of Indian dishes, and of course, 2020 they have also launched low carb diploma, low carb nutrition diploma in India, more Indianized one. So,
Yes.
yeah, Anup.
Yeah, welcome, Jane. Welcome to
Thank you.
the
Thank you.
first ever, and the largest virtual low carb conference.
Thank you both so much for this vision and for bravely flying the flag. I know it's a lot of work that goes into this. And Shashi, we've been watching the incredible work that you've been doing. And when you kind of first thought this up and actually imagined it possible, and here we are. Well done. Thank you for having me and us. Such a privilege.
Thank you. And I'll introduce Jayne first. So I think most of us might be knowing, but many in India may not be knowing. So Jayne Bullen is the managing director of Nutrition Network, and as a chief operating officer of the Noakes Foundation, she established Eat Better South Africa alongside inspiring colleagues and Professor Noakes, and she believes in building a strong collaboration in the nutrition and science. After realizing the dichotomy between brand research budgets and human health research, she decided to leave the formal research world, committed to bringing her global experience in big biz research, systems, and policy changes expertise into new areas to affect human health. So, Jayne Bullen is an MBA in Chevening scholar, high deep in marketing and international relationships graduate. In her MBA at Leeds University, she focused on regulation of marketing to children in the food and fast foods categories, later conducting pan-European media research and strategy evaluation in this area for various global health bodies and brands. As an extension of a collaborative vision for the future of human health and better healthcare system, she co-founded Nutrition Network and has been its managing director since it was founded in 2018. So Jayne, welcome to India's first pioneering largest low carb conference called Metabolic Health Conference. We are so happy to have you.
Thank you so much, Shashi, and thank you both of you for your vision and for doing the work that needs to be done, pioneering the way in India, which needs it, needs the support, needs the change and knowledge to be brought there.
So what has gotten you into low carb world? We are very curious to know.
So I have had a lifelong journey with insulin resistance. Of course, like most of us, we didn't know what it was for probably the first 20 years of the process. So I've been kind of in the category we now know as pre-diabetic insulin resistant since, I would say probably since childhood. Realistically, it was first actually medically detected and diagnosed as PCOS when I was about 20. But the signs, when I look back, were there long before that. And from that time on, so from sort of around the age of 20, quite young, I went on the journey of trying to get it right and fix it, of course, as most of us did. And that was totally, for many of the years of that journey, the wrong place, the wrong application of how to fix it. So it started with, the low GI diet and the low fat diet and the high, very, very high carbohydrate diet, and on it went. And of course, as it progressed, the more the disease progressed, the more extreme I became. So I went through a phase where I became vegetarian and then almost vegan, eating a very higher and higher carbohydrate diet that was perceived as healthy, more and more whole grains, fructose in my coffee and tea, because that was the healthy solution, of course, which led to non-alcoholic fatty liver disease down the line. We now understand why. And on it went. My metabolic disease progressed. So eventually I got to the point, which I know you both have, and I was just listening to Prof Noakes also before this talking about it, where I fortunately I never tipped into full-blown diabetes, but been very close over many times in my life, and eventually found low carb at some point along that journey twice. and twice had incredible results and then gave it up because I was worried about, cancer, health, like early on in the journey when it was still the Atkins and no one understood that you could actually reverse diabetes. It was like, well, this is working, but oh my God, it's going to give me cancer and kidney disease. And it's so dangerous that I'm just going to do it for a short intervention and then go back, which of course continued for many, many years. And like most of us, it took us up to 20 years. So eventually through that long journey, did come to the Noakes Foundation and suddenly got it really, really clearly, particularly working with and inspired by Prof Noakes, who is just such an incredible embodiment of a low-carb lifestyle and such an example to so many of how to do it correctly and how it can work over the long term. So that was what led me here and led me to the Noakes Foundation, wanting to get out of big business, out of corporate, out of the place that is the main driver and contributor towards global disease.
Fine.
So yeah, Jayne, you briefly described, how you landed up at Noakes Foundation. Now, the next question is, what's your work responsibility there, basically? And what is your aim?
So at the Noakes Foundation, our aim has, for many years, since it was founded in 2014 by the Noakes family, and Prof Noakes shared a little bit earlier about why it began, which was that he had reversed his diabetes, and he had obviously had a very big story and journey of indebtedness or wanting to fix things for himself in his own health journey from his own father's story. And then from that, it led to a need to want to give that back, the knowledge back, and make it more accessible to everyone. And I joined a year later in 2015. I was the first employee with, sort of not realizing, I don't think any of us at the time realized what we were getting ourselves into necessarily. But we started something. We looked at the research, and originally it was created really to fund research. So that was what we did in the first year, was we got some really, really good funding in. And we had 5 full-time students that we funded at the University of Cape Town, which is where Prof Noakes at the time still had an office in the Sports Science Institute there. It was before the Sugargate moment where his profession rejected him. And at that time, we were very research focused. But what happened quickly from there was when we started to really look at the research, and the research that was being done had been done, and we intended to do, we identified a couple of flaws with it, or gaps with the research. And the one was, of course, that it had been done on a very specific segment or demographic, which meant that it had been done mostly on men of a certain age bracket that were sort of a certain health statistic. And it hadn't included the ethnic and demographic diversity that we see in South Africa. It hadn't necessarily included women in that research. And in particular, the research groups and sample sizes had been small because the funding wasn't there. And that was my first big absolute shock, was I came from a much more corporate research read into that heavily funded research environment. And when I first started to look at firstly the sample sizes and then the budgets, I thought that there were a couple of zeros missing. Like, I just couldn't believe that it was possible that such important research had such tiny budgets. It just made no sense. It was like, how is it possible that advertising research can have these enormous budgets, like 100-fold bigger than research that is into the future of human health and the actual optimal diet for humanity? So there's and we all know it. I mean, there's a huge problem in terms of the funding of research for the good work. So that was the big moment that I had, where I just went, this can't be possible, and we have to change this. And very quickly after that, I met with a woman called Eodia Sampson. She's an actress from the Cape Flats in our area, an incredibly passionate human being who understood that our poorer communities in South Africa had not had any access to this science, and they were the ones that needed it the most. I also met with an amazing woman who you know well, Shashi, Dr. Hasina Kaji, and at the time she was working at in the largest government hospital in our city in Cape Town. It's a hospital called Groote. She was heading up the high care unit there, and she had the same vision. So the three of us met, and all three of us agreed that something had to be done very quickly on the ground, on the grassroots level. So the research was commissioned, things were going on a high level, or what sort of a more systemic policy change level. But what about the rest of the country? And what about the people in South Africa that at the time were just basically dying without even being diagnosed correctly? And that's across the entire spectrum of chronic disease in our country, but particularly diabetes and, sort of arterial vascular diseases that are associated with diabetes. A lot of the time people are not diagnosed, and when they get to the point of diagnosis, they're so far along the line that there's almost no hope left. And then at that point they were arriving at a hospital in a very, very acute scenario, and were being sent home with our standard dietary guidelines as their treatment and as their long-term kind of support system. And that, we all know, was what was killing them in the first place. So we created what's called now Eat Better South Africa. And that was very much from the support of the Noakes Foundation that agreed to pilot and fund one study, or one program actually, with a group of about 60 women that lived in a township near Cape Town, and that were suffering from sort of typical, metabolic disease symptoms. And that was where it began, was we said, well, we've got to do something different. It's not only about the research, it's actually also about just taking this work out educationally into the world so that people can get access to the information and start changing their lives. But we don't have time to wait for medicine to change.
So in Eat Better South Africa, are you providing some food or something? How is it? What exactly is it?
So what we started with was a 6-week program where we went into a community, as I said, this group of 60 people that signed up, and we gave them the tools that they needed to adopt a ketogenic or a carbohydrate restricted diet. And that meant starting with quite a big panel of bloods, pulling out candidates or patients that needed medical treatment. So obviously anyone that was on any kind of, sort of hypertensive or diabetic drug that needed actual tight removal or restriction of the program, and anyone that needed like extra special attention was treated by a physician or doctor. And the rest was seen weekly by a nurse who did the basics like blood glucose and hypertension, and then very importantly, weight and waist circumference. And that was the sort of foundation of the program, was that people would come together in a community hall once a week, and we would bring in, they would share, of course, that we would look at their bloods, we would look at their glucose, we would talk to them, we would bring in motivational and educational speakers. And we did not give them food, but what we did do was our diet. They wrote up a meal plan of what they had eaten for the days before the intervention, and then we adapted it very importantly to what they were already eating. So we absolutely didn't go in there with the Real Meal Revolution book and say, right, you all have to give up everything you're doing and start eating butter, grass-fed steak. It was very much like, okay, well, you're eating porridge and ultra processed food, and this is what your diet looks like right now, and how can we change what you're eating so your plate looks similar but it's a lot better? So that was the intervention, and the first one, or the pilot, was incredibly successful. Like, it was beyond our wildest dreams actually that we imagined that it could work so well. And because it did, I think we've run over 35 interventions now, which we still call them pilots, because we're still learning as we go. And we've never reached the scale that we would like to in terms of how we know that this works. We now understand, 8 years later, that it is a very, very sustainable and easy to adopt, easy to teach, and affordable intervention. So we believe it's the solution and the replacement to the treatments of chronic disease to some extent, or it's certainly the preventative approach that state healthcare should be and could be taking, which is very, very affordable. So in our country, we've brought it down to what we call 13 rands, South African rands per day per person. And that equates to, in US dollars, that's about 70 US cents a day for food. So it can be done, a ketogenic diet and intervention can be done on very small budgets and with very careful consideration for communities that don't have access to expensive, fancy keto foods and supplements. And I think that's why it's really interesting to share this information with the Indian community, because there is that perception that a ketogenic diet or a carbohydrate restricted approach is expensive and it's for the wealthy, kind of for people that have access to all the really expensive foods. And that's not the case. In our experience, it can be quite the opposite.
Let you say that the steak or meat is costing less than porridge, or is it costing same? How is it?
Sorry, so a steak homemade is costing the same as porridge? No, definitely.
Does it cost the same as porridge, or is it cheaper, or is it costing more? How is it?
Significantly more. I mean, like way, way more. So we're talking probably 10 times more, but that's not the only solution. So what we find is that there are a lot of other alternatives that we can use that are low carb and are significantly healthier than this kind of ultra processed, high carb, refined grain porridge that a lot of people are eating. So in South Africa, it's maize, it's something called millipap, which is a maize, a very, very refined, decolored maize product that is like almost pure sugar carbohydrate, refined carbohydrates, which we know is ultimately sugar. And what we can look at is ways to, and it's very, very cheap. So that one of the main reasons for eating that is price point and accessibility. So it has a very long shelf life. It's quite easy to cook. And then the other aspect to that is that there is an understanding or a belief that that is a traditional food. So culturally, it's kind of happy food for a lot of South Africans. They want to eat that and they don't feel satisfied if their meal doesn't have a significant percentage of pap in it. And I think in India, it's the same with kind of things like rice and naans and bread-based things that go with your main meal. So a lot of the work has been to change that. And part of that has been to create substitutes for that. And it's also been, more recently, it's been ways to educate people so that they get that bowl better without necessarily getting it 100% perfect. So we go for eating better, not perfectly. It may be that we get 60% less refined carbs on that plate, and there are still some, but at least the macros are balanced better, and there's a better variety and diversity on the plate.
I think that's very interesting. See, like you told that even if they reduce by certain percentage, even if it is 40, 50, it's still a win for them.
Yes.
Whatever 80 or 100% carbs they have, I think it's an excellent thing which is happening. And now we'll come to very interesting topic, that how was the idea developed for launching Nutrition Network? What all went behind it? What was the objective of coming out with Nutrition Network?
So as from the Noakes Foundation, where it really began was that we had this little list on our website of low carb practitioners in South Africa. And we had probably like 10 people or less on there. And of those 10 people, I think I went to 2 or 3 and kind of left and thought like, what are they doing on this list? They don't really understand, like it was probably an argument or a debate more than a consult. So it was disappointing and unsatisfying for me as a patient personally. And then I'm sure for thousands of others. And then what we found was that most people, because of this unsatisfying experience, were coming to Prof Noakes directly, trying to actually get him to answer their medical questions, which he, of course, had. I think when I joined, there were probably like way over 3,000 sort of things that he was keeping, wanting to respond to people, really like important questions that they hadn't been able to get answers from medicine, and they were desperate. So it was this question of, well, what are we going to do with all these patients and how are we going to fix this problem? It then evolved into a more pressing matter, which was that with Eat Better South Africa, we were taking groups of people through a low carbohydrate intervention and we were needing referring doctors. So we would go into a community, somewhere around the area that we operate in, and we would have to find a doctor and then try and train and convert a doctor to understand the science so that we could get them to treat the patients during the program. It was quite hard work, and it involved Dr. Kaji, who was our medical director at the time, doing a lot of driving and actually taking on a lot of those patients herself, because there was no one else, or there were very few other people locally that understood low carbohydrate science. And yes, of course, a lot of people did. But we weren't confident that they actually knew enough to really take a patient through a reversal process. And that's ultimately what we were heading for and wanted to achieve. So we as a foundation decided, okay, this is what we have to do. We have to train doctors. That was where we needed to start. And we started with Dr. Neville Wellington, who has a very, very early progressive practice in the process of diabetes reversal through diet, and Dr. Hasina Kaji, who came from a more state healthcare physician's perspective of wanting to help underserved communities. And we decided that we were going to try and train, a handful of doctors in South Africa, so that within a year we would have a group of people that we could refer patients to. And what happened instantly was that it was actually a global solution, not a local solution. So we were very lucky. It, of course, was quite a difficult time for us, because we didn't realize how much of a need that was in the global community when we launched in 2018. So that first year we trained many hundreds of doctors. And since then, we've trained over 7,000 practitioners around the world in over 100 countries. So it grew very, very quickly. We were very lucky that we took this risk. We decided to do it. And it was very much created as a way to fund the Noakes Foundation and the really important work that we wanted to do there on the research. So it fulfilled that goal to a large extent, or to some extent. I wouldn't say we've done as much as we could have and wanted to. But that's where it began, which was really with just seeing a need and wanting to fulfill it for our own support structure locally.
That's very interesting. So you say that this was founded for the purpose of educating doctors.
Yes.
And then you started educating us coaches also.
Yes, so that came a little bit later on. So we were very much medically focused, and we still are to a large extent. So, medicine was the first thing that needed to change the most, perhaps, I would argue. And our kind of founding vision positioning was to change medicine one practitioner at a time. And we really felt that we needed to find places for patients to be supported. It was really from a patient's eye. It was like, I'm going to say from my own eye, I was an angry patient, because, once I got the science, and I'm sure you've both been through this, it was like, I thought back to all these kind doctors. I mean, doctors are always mostly kind people that really want to help their patients, that had given me the wrong advice for 20 years. And firstly, I was like angry at them. And then obviously unpacking it more, I realized that it wasn't their fault. They were doing what they were taught. And then it asked the question of, well, what is wrong with what's being taught, and how on earth are we going to change what's being taught? I mean, this can't carry on. Like, we've got to intervene here. I want my son, who's now 15, to actually have like healthcare that understands metabolism and understands diet. And I want his children to be treated in a way that is going to give them the opportunity to have a healthy life and not be an obstruction. And that it's almost like medicine has somehow become an obstruction to health. So we changed in 2018, we were founded, and about a year or two later, we changed our vision from changing medicine to changing healthcare. And that was important, because that's where coaches came in. And we realized that we can't do this without coaches, and that behavioral change and lifestyle cannot be changed by a doctor. People go to doctors when they're in an acute stage in their lives, when they're ill, when they're diseased, and that gives doctors an immense amount of power, of course, to really shake a person up, to shock them, and to make them make a decision to change. But then they leave with their packet of pills and a diet sheet, and they head off home in shock, and they probably go past the shop and grab, either a Coca-Cola or a McDonald's or something that is what comforts them, because that's how they got diabetes in the first place. And then what? And then how do we actually change? And coaches are one of the most important pieces of this toolkit. So we call our coaches advisors. And, advisors are just that first stage, which is just a person like anyone out there that wants to offer advice, whether it's to their husband and wife or to their church community or to their school or anything like that, or to their business. So we have a lot of people that work in policy or government or structural systemic places that want to know how to advise about nutrition in an informed way. So that was sort of where we began with coaches, as we said, let's offer people the opportunity to advise others on their health or their diet, but not in a way that's medical, in a way that just brings the science in. And of course, then you were one of those. Thank you for trusting us with your knowledge. And I know you've done so much and have trained in so many areas. So you're such an incredibly informed, embodied coach. But of course, then what came from that was that we realized that's not probably enough for people like you that want to really take it far and actually make bigger changes with patients and walk the line with them. And that was when we started to do a much more intensive certification where we really, once someone's done that, we know that they know the science and they know how to change, actually implement meaningful change. There we go. And that's what leads to that. It's a long journey. But once somebody has got that qualification, we know for sure that they are able to manifest and implement meaningful change for a patient or a client. And that comes with healthcare and with medicine. So the vision behind that was that coaches and doctors or physicians work closely together on a patient to support them change their lives for the long term in a sustainable way.
Very interesting. And it is not only, local is a small part. You have gone global. I mean, we have a full colleagues and groups across the globe. Like in this coach practitioners, we have made friends. We are there into WhatsApp from across the globe. We have formed a sort of alliance also. And can you tell us more about what are the different courses available? See, coach practitioners is an advanced one, where you select a few people and who can do. What about the other courses? What exactly are they? What are the other courses? Hello.
Shashi, my apologies. I lost you.
There's some signal issue. So what are the different courses which are available? We know the coach practitioner is an advanced one. What are the other courses available?
So we have, since 2018, we have actually produced 36 CME trainings or CPD, depending on which country you're in. And those trainings are quite diverse in the nature that sounds like so much, and it has felt like a lot, but the reason we've taken so many trainings is because of the need for them. So as we've gone, we've realized there's a gap here. Science keeps evolving, the story and the science keeps changing. And with that, we've had to keep bringing out trainings. So our sort of foundational trainings we have a training called Ketogenic, which is obviously based off the book. So it mirrors the book and it's seen as an adjunct training to the book. And that's really the basics for medical professionals. So it looks at it's kind of the 101 of therapeutic carbohydrate restriction. We also have applications of that are specialized. So we have a dietitian's version of that and a nurse's version of that that are a little bit more tweaked. Obviously dietitians deal with different things. They need different kinds of collaborators, and nurses the same. So the nurses is very hands-on. It's, it's wound care. It's very practical. And also nurses, I just want to mention nurses because nurses are one of the most important pieces of the healthcare puzzle that are very, very underestimated. And we really want to support nurses in as much way as we can. Nurses are the people that have actual conversations with patients when they're hospitalized, when they're crying, when they're really at their most vulnerable. The doctor or the physician comes in quickly and they're busy and they, rub the patient's shoulder and give them a script, and they don't have the time that it takes and the care that it takes. So nurses are very important, as are dietitians, of course. So that's our kind of foundational training. And then attached to that is the advisor training, which is the basic training for coaches or advisors or lay people. So a lot of people like personal trainers, people that work in sports and sports nutrition, people like yourself yourself that have come from business and want to influence, do that training. And then from there, we've gone into specialized training. So we have things like the basic sciences, that's a new training. We have things like women's health. We have clinical applications and clinical practice of LCHF. We have the diabetes reversal training. We have an obesity reversal training. These are slightly shorter trainings. An important one that we have, which forms one of the foundational trainings on the Society for Metabolic Healthcare to become an SMHP or an MHP, is an ethics training, which helps healthcare workers understand better how to work with media and with communications around communicating sort of the use of low carbohydrate science in medicine. And that's important because so many people have felt very isolated, very targeted, very afraid to talk about the science because they're worried that they're going to have to go through what Prof Noakes went through. They're also worried about they're not sure what they can and can't say about nutrition. So for a very long time, if not forever, doctors have been seen as not being allowed to talk about diet in medicine. So they are not allowed to talk about the diet with the patient, and they are told to refer a patient to a dietitian. And there's this sort of overt, exaggerated separation between medicine and diet. And it's a huge problem because, people are seeing a physician or a doctor for a health problem, and the doctors are concerned about talking about the patient's diet, which is in most cases of chronic disease, one of the primary drivers of the disease. So this is, we want doctors to have, particularly doctors, but a lot of other specialists in other areas, to have much more confidence in the way that they talk about the importance of diet in treating patients and in medicine again. So it's an empowerment. The idea is to re-empower around diet. We've also got some slightly more neurological psychiatry type trainings, and then also one training which is for patients, and that is designed for a doctor to give to their patient when they're diagnosed, so that the patient can kind of reverse themselves. In principle, that was designed by Dr. Neville Wellington, and based on his incredible success story with hundreds of patients over years, to reverse their own diabetes ultimately. And the doctor's there as a guide, and to prescribe, or ideally to de-prescribe medicine, but ultimately a patient's journey is their own, and it's up to them. So, I mean, I'm not diabetic, but I've got a CGM on my arm at the moment, and I'm trying out new things as we go and testing it, and, bringing in a few little treats that I like, and then being shocked and horrified, and in some cases not shocked, and going, okay, well, this is okay for me and that's not. And that's the empowerment journey. That's how we change health for the long term, is we learn ourselves. And doctors, many of the doctors that we work with are actually doing this because their patients sent them to us, not the other way around. Going through some of the other courses, we've got a really important training that I wanted to mention for the Indian community, which is called the Eat Better training. And that's a group facilitation training that is based on our model that I talked about earlier, Eat Better South Africa. So it's exactly what we did with these groups in our local community. And why it's relevant to India is because we have similar problems or dynamics within our socioeconomic structure, where we have, a very, very high Gini coefficient. We have the wealthiest people in the world and the poorest people in the world sitting and living very closely to each other. And this was designed for the poorer, or what we call kind of the community people in our country who have very limited budgets. So it's for anyone that's interested in supporting those communities to eat better. We actually decided we're going to offer everyone that's based in India on this training 80% off, so almost free, hopefully, if they want to do that training. I've got a code here for you if you want to use it, which I can share with Shashi later. So we'd love you to just do it and see if there's a way that you can apply it. We would love to see it. Eat Better India. It doesn't have to be Eat Better South Africa. Like, how can you get India to eat better and to support, we don't want to see more than 100 million diabetics in India. That's more than any country should ever have to face. We also have sports nutrition. We've got a training around resilience that came out of COVID, is how to bring resilience into your lifestyle changes. And then a very important training, I think, probably one of our most important trainings we've ever brought out last year, was called Addictive Eating, where we, for the first time, along with our global community, realized that we can't just be going on and on about the science, and that we had to start offering addiction support. And not everyone calls it addiction, so we've called it addictive eating. We like to look at it as behavioral change. But ultimately, diabetes is this function of addictive or behavioral or emotional eating. In many, I'm not saying that's the case for everyone, but perhaps more than 80% of diabetics have a problem with eating or an eating disorder that needs to be addressed. So that's an important area that we are growing into the next year with some other more customized trainings. Women's health is a very specific area. I'm just going through our list. There's so many trainings that I'm not going to go through all of them. We'll be here all day. Another important product of ours is our community. So we have a community that's kind of the cheapest way to engage with the Nutrition Network. You don't have to spend hundreds of dollars. What we try to do is to make our trainings affordable and add value. And our community came from our community asking for a place where they could be in community. And as you said, you talked about your group on your coach certification, how you've become like I don't want to use the word family because that might sound a bit cultish, but how you've become a support system for each other. And what we saw was, before low carb, in 2018, or even in 2014, when the foundation first began, the people were very isolated. So like Prof Noakes had to really kind of be he is a bit of a rebel, but he had to be quite rebellious in his decision to, as a patient and as a practitioner, because he's both, ultimately we all are, or all practitioners are also patients to themselves. He had to be very rebellious, and he had to go through a hell of a lot. A lot of unnecessary trauma, and he had to do a lot of work with his family and his colleagues around acceptance. And I think many people that have been adopted a low-carb diet have had this problem. And I know certainly in India, that's even more exacerbated because of the combination of vegetarian and high carbohydrate plate that you eat. So you're going to a social gathering, community eating, and then the outlier. You're the different one. And it's even more so, even much more so, I'm going to say 10,000 times more so for practitioners. So isolation was one of the biggest challenges that our practitioners were facing. And they were, somewhere in the world alone in a hospital that did not support actually thought that what they were doing and talking about was illegal potentially. And then what? Like, how on earth do you navigate this? And what do you do? And who is your community? And is there anyone nearby? It's like a lot of people had no one near them or in their country or even continent necessarily that understood their language and that could give them advice. So a huge part of our global community that so many of us, there's so many incredible, and this is an example of that, is there's a community of people that have found each other. And how do we support them? We create beautiful events like this. So thank the both of you that are such visionaries in this. But then how do you, in India, which is what you're doing, and what you're doing is you're creating a local network of people that can be there to support each other. And it's only through numbers that we're going to actually change the future outlook of human health. It's only when everyone understands the science, and it gets down to like school teachers. Actually, my son came home 2 weeks ago with the food pyramid in his book, and he's kind of clever enough to know when not to talk about low carb, and he just fills it out with the carbohydrates, the whole thing at the bottom, because he wants to get full marks and he doesn't want to fight with his teacher. But it's like our schools here are still teaching that food pyramid with the mass. Almost 50%, I think it's more, 60% of the diet is refined carbs and grains. And, not a lot's changed yet. So communities are important. We have one solution, which is a community platform where there's good conversation, where there's good dialogue. We don't find Facebook and places like that are ideal, even though we're all there all the time and we love to talk about it. The majority of our participants do not want to be on Facebook. They don't want to be on our listings page even, because they're still scared. So that's a tiny percentage of the people that have done our trainings are actually listed as having done our trainings. They're still somewhere in the world being quiet about this knowledge. And that's a huge injustice.
I think many from our own D-Life community are also have done courses in Nutrition Network. It was very interesting. And from the Nutrition Network group itself, we have some speakers. We have Dr. Andrea Salcedo coming in tonight in India. We have Dr. Nurzetti, Dr. Carlos, to name a few. So
amazing.
All of us, Dr. Louis Philippe, how can I forget? So she's also going to speak on the last day. So from the same community, we have a lot of medical doctors in favor of low carb is also going to speak. Yeah, Anup.
Amazing.
Yeah, Jayne, you had shown, given a brief glimpse of that textbook.
Yes.
Textbook. So can you please, talk more about what all efforts have gone into getting it to stands, basically? Everything.
Yes. So I know Prof spoke quite a bit about this and the amazing story of kind of why we did this, which I think is obvious. There's something about this, which is feeling the actual weight of something in your hands and having it to turn through. And it didn't feel real to me. I mean, it took us 4 years almost to publish, to go from kind of start dates, not conceptualization was before that, but from the date that we actually signed contracts and it was a go, to this point that this actually arrives on our desks. And it seems like a long time, but when you look at what's in it, it makes sense. We've got 68 authors, 11 editors, 2 managing editors, and a million other hands that went into the production of this. So I don't see it as ours necessarily. I see this as like a project of the collective that allowed us to put something together big enough and solid enough in terms of referencing that we actually have a huge, convincing, heavy 540 page 1.8 kilograms. And I know this because I had to leave 2 of these at the airport when I was traveling to America recently, because I was about almost 4 kilograms over and I had to take them out. So I know their weight. That's what was needed. It's like, I don't see this much evidence in any other diets that I've ever seen before. I haven't seen the science behind the low-fat, calorie-restricted diet that is this weighty and this solid and this significant. So we knew it was important that we had to go there and that we had to actually print and cut down trees to make this point. Even though our community has known it for so long and has been working in this field. So it's very easy when we're working together and working with our colleagues in an environment where we all agree. But out there is mainstream medicine that is still teaching, that still filters through into children's textbooks having the wrong food pyramid there. And that means that for the next 20 years, those people are still going to typically end up with diabetes because of what they've learned now. So this is a long-term game, and I think we're all in it. So 4 years to write the textbook isn't long in terms of the fact that it takes between 20 and 40 years to change a system. And that's what we're trying to do now, is we're trying to say there are flaws in the way that medicine has evolved and adapted. Unfortunately, somewhere along the line, it went from all the beautiful visions that we see in the Hippocratic Oath, which is why many of the people I know came to medicine, is they really, really do believe in the values espoused by, Hippocrates and when medicine began, which is really to put the patient's life first and to support health. And there was a lot about nutrition back then in the very early days when medicine began. And somewhere between then and now, well, we know what's happened. And we can't blame, because every time we've gone to the shop and chosen with our wallets what we want to buy, we've been part of the system and we've supported the wrong choices. So this is one of the important pieces of getting acceptable science on the right desks, hopefully in a sustainable way, so that people will start to use this and look up conditions. So what we've done in this textbook, quite carefully and with immense respect to the editorial team that really, really spent years talking this through and structuring the contents very carefully, is we have almost every kind of scenario. I mean, of course, it's not all comprehensive because we need probably another 5 versions of this book before we could actually include every application of therapeutic carbohydrate restriction. But what we've shown is that iceberg that a lot of our amazing lecturers often share in their talks and that Prof Noakes often uses, which is that the tip of the iceberg, which is diabetes, obesity, and chronic disease, what's going underneath, what those different illnesses and disease profiles look like along the range of it, from insulin resistance to full-blown diabetes, and what sits under them, which is everything from neurological disease to cancers to everything else, cardiovascular, not everything else, but so many other things, from cardiovascular disease to, I mentioned cancers, to a whole range of neurological and musculoskeletal and immunological considerations and diseases and challenges that we face. And then how we're actually going to use these to treat patients. So in principle, a doctor could have a patient at their desk today, and they could, instead of going and picking up the Merck manual, which is basically a pharmaceutical listing of a disease matched to a drug. So they can, it's very easy. I mean, I've been to so many doctors in my many, many years of health challenges where they've gone, oh, okay, you've got this is the blood results. And then they've picked up the Merck manual and they've looked it up through the index and they've written a script and said, right, this is what you need to go to the pharmacy, go and buy this is your solution. And we've ended up very, very addicted to medications and to the concept that medicine is what's going to reverse disease in this modern world. And unfortunately, we now know that is not the case, and that in most chronic diseases, medicine doesn't really work. So what we're hoping is that the doctor will maybe look at the Merck manual as well, because there's nothing wrong with medication in the correct application, but look at this and go, okay, well, this person is looking, rheumatoid arthritis can be treated for acute problems with, very often it's with an opioid, which we know is addictive and kills people. But at the same time, let's look at a therapeutic dietary medical protocol alongside this that is heavily referenced, heavily evidence-based, and the patient's going to go home with at least a couple of options. And what we hope is that's through the range of medicine. So, from the functional medicine, where they're going to go with maybe just a diet and a couple of supplements, and all the way through to the very, very allopathic range of things, where they go home with the script is the most important, but there is attached to that script a couple of other things that are dietary and that are consideratory and that are going to bring in different perspectives. And that's all that, certainly for myself as a patient, I'm not angry anymore, but all I wish was that I'd had other options presented to me at the time, and not just you must take metformin. It's okay, well, what is metformin? And, there was very little around that. You could take metformin or berberine, or you could try changing your diet in this particular way and doing a lot more exercise and addressing your trauma and stress, which was one of the huge drivers of my particular condition. No one really told me those things. So it created a huge amount of anxiety for me, because I moved from South Africa to England when I was 20 something, a couple of years after I was diagnosed. And in England at the time, insulin resistance was not recognized by the NHS, the National Health Service, as a condition or a medical condition that needed treatment. So I would go to my local GP and he would go oh, your blood sugars are fine. And they didn't test for insulin or for anything else. In those days, they didn't test for HbA1c even. And then I would say, well, okay, but my doctor in South Africa prescribed me with metformin. Can you give me a script? And he would say, no, definitely not. That's for diabetics. And then, 20 minutes later, I would leave there either in tears or feeling like screaming, because it was pointless. And then I would come home once a year and get a 1-year script and take back a year of metformin, because there was this anxiety now that I have to be on this particular drug, because that's the only thing that's going to help me. Meanwhile, of course, now I know that that's just one thing, and I didn't really need the metformin necessarily. I just needed advice and knowledge, and no one gave me that. I really had to work very hard to find it. at huge cost to my own health, at huge financial cost and at huge emotional and burdensome other costs to actually get to the answers, as did you. I'm sure both of you did too. You didn't just have them presented to you. You had to go really far and be quite rebellious and argue and fight and just to get this knowledge. So let's hope that our next generation of doctors at med school and our children don't have to fight the way that Prof Noakes had to fight. I mean, I'm talking about how I had to have a little argument with my doctor, but Prof Noakes had to go and sit in front of a global, basically the global media was at his trial there, kind of trying to gun him down. It was extremely traumatic. He plays it sometimes, but it was a 4-year grueling battle that nearly tore him apart and tore a lot of the being of who he was. It put it into question and put his integrity into question. And I mean, he just did this because he saved his own life, ultimately.
Very nice. And I think this is, as you say, that this book is heavily referenced. So people cannot say that this is not a well-known science. People cannot say it's a fad diet. People cannot say it's a scam, fraudulent. Nothing people can. Now that we have a textbook, and that too published from Elsevier, it is an official textbook which medical doctors can refer. And I think any one of us can always use now this book as a reference. I think it's a pioneering and big breakthrough which has come from Nutrition Network. I think hats off to all the contributors, all the doctors who have contributed, the editors, and as you say, millions others who have put in a lot of hard work in really getting this together. I think it's hats off. It's a big thing.
So I'm almost imagining going back 20 years now when I sat at that first doctor that diagnosed me, and just imagining that like he had this there as well as the Merck manual. And that's hopefully what we're going to imagine into the future together, is that like we really do change the way people are treated by medicine and the way that health is seen. And there are options given to patients early on.
Thank you. And so, Jayne, we are almost coming to the end of the session. And what is your message to India?
So I would say to India that you don't need to have these 100 million diabetes. We know that it's probably double. So when we see a statistic about diabetes, 100 million, we know it's at least double, because there's at least more than 2 of that are along the range pre-diagnosis. There is going to be some changes that will have to be made in what your perception of tradition is, but it doesn't mean you have to give up traditional diets. You don't have to change what your sort of understanding of like community eating and tradition is to be healthy. And you can find a way to be healthy within the system that you're living in. So, and Shashi, you are the example actually, and you are the living message. So there's the message right there. Look at you're a person who has fully reversed diabetes and who is living an incredible life. So you've probably given yourself an extra 30 to maybe, knowing you, 100 years extra that you wouldn't have. You would likely be dead or dying by now if you hadn't found this. So I think my message is to keep an open mind and actually just to eat better. So it's to eat better India. Like, don't think that you have to go the whole way. Find ways to change small things on your plate. Find ways to eat, if like halve the rice and bring in something else there. Eat half the chapati or half of the naan or things that have got a lot of refined carbs in them, and bring in Indian food is one of the best, most incredibly diverse foods in the world. So like, don't fall into that trap of believing that you have to eat a high sugar, highly processed, ultra processed food diet. I mean, that's wrong. And that's a function of like decades of kind of cost cutting and challenges in the food system. So be a part of the change, ask questions around what you're eating, and then be demanding when you need to be, and say no to certain things. You don't always have to say yes to the food that is put on your plate or that everyone around you is eating. And sometimes that means, upsetting a couple of people and doing things a little bit differently at certain holidays and festivities and things where there is a particularly high carb environment. How beautiful. What an opportunity.
So I am 8 years in remission, and Anup Singh here, he's more than 12 years now, and I learned everything from him. It's due to. So Anup is here for, more than 12 years, Anup, in remission.
Yeah, completing 13th in Feb.
So
Amazing.
he never even took
And
any single tablet of metformin. He was so adamant.
Jayne, when I started low carb, there was no reference available. In the sense, no one was there to handhold. Now, obviously, as you said, Merck will refer us. When I went to him, he said, if you're going for low carb, high fat, you will have multiple organ failures within next decade.
Yes.
And here I am still alive. So that speaks about the credibility of the diet and medicine free.
Amazing, Anup. Wow. So just to the two of you, obviously, Shashi, we know each other quite well. And Anup, I know your work, and I've been watching your amazing work that you're putting out into the world, and you're both such incredible pioneers. So I feel so grateful to be in your company and to be able to offer whatever support that we can and that I can to really support India. India is an incredibly important country to me in my heart, and I know to most of the world, but particularly to me as a lifelong yogi and sort of follower of a lot of Indian cultural belief systems, in particular Ayurveda and other things. And it's like, we can't see India falling apart and, it's kind of dying of diabetes. Like India is a place where health is actually manifest and comes from in the world, and where people from all over the world go to find health. And this work is so important, and what you're doing is so important. So as I said earlier, we would love to support anyone that wants to do our Eat Better training, which I believe could just be applied to Eat Better India. Like, I think the applications and the switchover aren't that difficult to make. It's a very culturally designed and informed program. We've got a code. It's EBSA, EBSA India. And if you purchase the Eat Better group facilitation training, you get 80% off, which is the best we can do. That's like below cost. So it's kind of almost free to anyone that wants to, that's at the summit and that's based in India, that thinks that they might be able to bring those ideas into their local community. We would love to invite you to do it and to see what you think and to let us know what you think you can do and how you can work, obviously, with the two of you and with us in any way that we can support global health.
Sure,
And then
sure.
certainly it is something, I invite Anup Singh, and there could be a collaboration between D-Life and Nutrition Network. Maybe Anup and Jayne, you can design a course which could be useful for the global community. No doubt D-Life has a local nutrition course for Indians, but what about many doctors would like to know how to treat an Indian patient, because Indian patients are very tricky, not very easy to handle. So our cuisine changes every 100 kilometers. So I think maybe Anup and Jayne, we can design something which is mutual, something we can design for the Nutrition Network platform. I look forward for this.
Sure,
Thank
Well,
you.
we've got so much to learn from India. The world has got so much to learn from India about how to eat, how to bring flavor and joy and community and connection into food and eating. So I think that's an amazing idea.
Thank you. Thank you very much, Jayne, that you can spare 1 hour for India and come and share the pioneering work that has been done in Nutrition Network, in being a global educator on low carb, as well as taking the initiative of getting the first textbook. Thank you.
Thank you.
Thank you both so much.
Namaste.
Looking forward to the rest of the weekend.